Cholecystitis, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Cholecystitis, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of cholecystitis. Chapter 1. 1. What is cholecystitis? Cholecystitis is the inflammation of the gallbladder. 2. What causes the inflammation of the gallbladder? The inflammation of the gallbladder occurs when bile gets stuck in the gallbladder. 3. What is the main function of the gallbladder? The main function of the gallbladder is bile storage. 4. Where does the gallbladder release bile? The gallbladder releases bile into the small intestine. 5. What organ synthesizes bile? The liver synthesizes bile. 6. What are the functions of the liver? The functions of the liver are the production of bile, the excretion of bile, the metabolization of fats, carbohydrates, proteins, vitamins and minerals, the storage of glycogen, the activation of enzymes, detoxification, etc. 7. What are the causes of cholecystitis? The causes of cholecystitis are gallstones, blockage of the bile duct, tumor, damage to the blood vessels, infections, etc. 8. What are the two main types of gallstones? The two main types of gallstones are cholesterol stones and pigment stones. 9. Which type of gallstone is the most common? The most common type of gallstone is cholesterol stones. 10. Gallstones are usually made up of. Gallstones are usually made up of cholesterol. Chapter 2. 1. What is cholesterol? Cholesterol is a type of fat. 2. What are the signs and symptoms of cholecystitis? The signs and symptoms of cholecystitis include fever, pain in the abdomen, pain in the back, pain in the right shoulder, jaundice, nausea, vomiting, sweating, etc. 3. What is jaundice? Jaundice is the yellowing of the skin due to an excess of bilirubin in the blood. 4. What is bilirubin? Bilirubin is a yellow pigment formed by the breakdown of erythrocytes. 5. What are the complications of cholecystitis? The complications of cholecystitis are infection of the bile, gangrene, perforation of the gallbladder, abscess, peritonitis, etc. 6. What is gangrene? Gangrene is the death of body tissue due to a lack of blood supply. 7. What is an abscess? An abscess is the accumulation of pus. 8. What is peritonitis? Peritonitis is the inflammation of the peritoneum. 9. What is calculus cholecystitis? Calculus cholecystitis is the blockage of the cystic duct by gallstones or biliary sludge. 10. What is a biliary sludge? A biliary sludge occurs when bile stays in the gallbladder for a long time. Chapter 3. 1. What is a calculus cholecystitis? A calculus cholecystitis results as a complication of a serious condition that destroys the gallbladder. 2. Which is more severe, calculus cholecystitis or a calculus cholecystitis? A calculus cholecystitis is more severe than calculus cholecystitis. 3. Which is more common, calculus cholecystitis or a calculus cholecystitis? Calculus cholecystitis is more common than a calculus cholecystitis. 4. Can a person live without a gallbladder? Yes, a person can live without a gallbladder. 5. Can cholecystitis be prevented? Yes, cholecystitis can be prevented. 6. How can cholecystitis be prevented? Cholecystitis can be prevented by having a balanced diet, having a stable and healthy weight, etc. 7. What is the function of the white blood cells? The white blood cells protect the body against diseases and harmful substances. 8. During an infection, what happens to the white blood cell count? During an infection, there is an increase in the white blood cell count. 9. What is gangrenous cholecystitis? Gangrenous cholecystitis is the necrosis of the tissue of the gallbladder. 10. What is necrosis? Necrosis is tissue death. Chapter 4. 1. Is cholecystitis the same as cholelithiasis? No, cholecystitis is not the same as cholelithiasis. 2. What is cholelithiasis? Cholelithiasis is the synthesis of gallstones. 3. Can rapid weight loss lead to gallstones? Yes, rapid weight loss can lead to gallstones. 4. Can obesity increase the risk of gallstones? Yes, obesity can increase the risk of gallstones. 5. What is cholangitis? Cholangitis is the inflammation of the bile ducts of the liver. 6. What is sepsis? Sepsis is a life-threatening response to an infection. 7. What is vasculitis? Vasculitis is the inflammation of blood vessels. 8. Vasculitis can also be called angiitis. 9. Is hyperlipidemia a risk factor for cholecystitis? Yes, hyperlipidemia is a risk factor for cholecystitis. 10. What is hyperlipidemia? Hyperlipidemia is the presence of high lipid blood levels in the blood. Chapter 5. 1. Can cholecystitis cause fibrosis? Yes, cholecystitis can cause fibrosis. 2. What is fibrosis? Fibrosis is a repair tissue. 3. Can cholecystitis cause pancreatitis? Yes, cholecystitis can cause pancreatitis. 4. What is pancreatitis? Pancreatitis is the inflammation of the pancreas. 5. Can cholecystitis cause peritonitis? Yes, cholecystitis can cause peritonitis. 6. Can diabetes cause cholecystitis? Yes, diabetes can cause cholecystitis. 7. What is diabetes? Diabetes is a chronic illness that causes high blood glucose due to a lack of insulin or insulin resistance in the body. 8. How is cholecystitis diagnosed? Cholecystitis can be diagnosed by blood tests, ultrasound of the abdomen, CT scan, HEDA scan, MRI scan, liver function tests, etc. 9. Can cholecystitis be treated? Yes, cholecystitis can be treated. 10. How can cholecystitis be treated? The treatment for cholecystitis includes fasting, intravenous hydration, pain medications, antibiotics, endoscopic retrograde, cholangiopancreatography, cholecystectomy, etc. Chapter 6. 1. What are antibiotics? Antibiotics are medications used to fight bacterial infections. 2. What is endoscopic retrograde cholangiopancreatography? Endoscopic retrograde cholangiopancreatography is a procedure that enables the removal of stones that block the bile ducts or the cystic duct. 3. What is cholecystectomy? Cholecystectomy is the surgical removal of the gallbladder. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding cholecystitis.